Hello, my name is Marcos Muñoz, and I am part of the Professional Services Department at Lenticon, Spain. And I am pleased to present the Ortholen Pro design for orthokeratology. Let's start. What is orthokeratology? Well, it is a clinical procedure to reduce myopia based on the programmed wear of specially designed gas-permeable contact lenses that reshape the cornea while sleeping, allowing clear vision during the day. And at the same time, it slows down the axial growth of the eyeball. How does it work? Well, the type of contact lens used are manufactured with inverse geometry curves. This geometry creates two pressure zones over the cornea. A central positive pressure zone that allows the corneal apex to flatten, and a negative pressure zone that enables the cornea to stiffen. There cannot be a proper change in corneal shape without an adequate negative pressure zone. Who are the target patients for this treatment? Well, those who need to control the growth of their eyeball due to its proven effectiveness in controlling myopia. Those who are not suitable for refractive surgery for any reason. Those who need freedom while playing sports and do not want to rely on glasses or contact lenses. Any age, although in children, the responsibility of the individuals must be considered. And in adults, it should be monitored that they do not have very large pupil diameters. And we have to consider slower results. It is a good alternative to glasses for these people who do not want to use glasses or contact lenses for their daily activities. And it is also a good alternative for patients who experience intolerance to other types of contact lenses due to tear-film defects, but pathological dry eye is obviously excluded. Which patients are not ideal but not impossible to treat? Well, these patients may present certain difficulties in completing the treatment successfully. Those like the ones with significant internal astigmatism, maybe greater than 1 diopter, for example. Orthokeratology just compensates for corneal astigmatisms. So if the patient has internal astigmatism, residual astigmatism will appear, and that cannot be compensated. And also those with a refractive astigmatism greater than half of the manifest sphere. These patients have very good visual acuity with glasses, and since the astigmatic part of their refraction plays a major role, they may not see as well during the corneal molding process as they do with their glasses, and may subjectively report visual discomfort. There are patients who are unviable, and it is strongly contraindicated to begin treatment, and an alternative to orthokeratology treatment must be found. Those with corneal ectasia, orthokeratology cannot be performed on patients who present any type of diagnosed corneal ectasia. And in suspected cases, or when the flat K exceeds 48 diopters, it is recommended to refer the patient to ophthalmology before starting orthokeratology treatment. and those with pathological dry eye, such as Sjogren's dry eye syndrome, cannot begin orthokeratology treatment. Ortholen Pro design consists of 4 zones. A, an optic zone, of course. B, a transition zone. C, an alignment zone. And D, edge lift. And the design parameters are R1, which is equal to the flat meridian of the patient's keratometry, or the manifest sphere with the patient's vertex distance correction, OR2, which is the toricity need in diopters, to correctly align the alignment zone to achieve an homogeneous edge lift. If it's 0, the lens will have a spherical alignment zone. R2 is the toricity of the back optic zone. If it's 0, the optic zone will be spherical. R1 goes from 660 to 9.0 in steps of 0.01 millimeters. OR goes from -8 to +5 in steps of 0.25 diopters. OR2 goes from -5 to 0 in steps of 0.25. The power of the lens is always plus 0.50 diopters in cases of myopia treatment, and in the cases of hyperopia treatments, the power of the lens will always be -1. Optic zones goes from 6.4 to 5.6, or in the cases of myopia management, the optic zone will be always 5.0 millimeters. And the optic zone is calculated according to the OR and the diameter. And this is not a parameter that can be selected by the professional. Diameters comes from 9.80 to 11.80 in steps of 0.20 millimeters. And R2 goes from -3 to 0 in steps of 0.25. How could we start? Well, there is a protocol for fitting Ortholen Pro. First, we will start by calculating the lens with the Simulens software, which is an online fluorescein pattern simulator based on our patient's topography. When the first lenses were manufactured, the first fitting day we'll have to evaluate the fluorescein pattern with the lens on and assess the edge lift, whether it is insufficient, excessive, or uneven. The morning after the first night, the evolution of corneal reshaping must be evaluated with topography to adjust the parameter of each lens. And at each visit, a refraction without the lens must be performed to assess the patient's refractive state, as well as another refraction with the lens on the eye. And of course, the health of the ocular surface must be evaluated throughout the process. Since the lens calculation is purely based on the patient's topography, it is extremely important to have reliable topographies to avoid erroneous lenses and unnecessary parameter changes. In these 2 examples, there's an incomplete topography. These dots indicate that this area of the cornea has not been read, Therefore, it is an assumption of the topographer, and we cannot take it as a reliable measurement. In the second example, the topography is out of focus. The image must be properly defined and focused to avoid errors in measurements. A commonly forgotten parameter that is very important to determine whether a topography is correct or not and free of corneal molding is the eccentricity. It is important not to have negative eccentricities or poorly recognizable topographic patterns without a defined pattern itself. Repeat the topography after more days without wearing any contact lenses, or even adding into the eye a moisturizing solution. This is an example of how to calculate an Ortholen Pro lens with Simulens platform. First, the patient tab is selected, which gives us access to choose to perform the calculation with using topography or manually entering keratometric data. In this example, we will use topography option. As can be seen in the list, the most common topographers on the market can be used. Each topographer has guidance for correctly importing the topography into Simulens. This is an example with Metmon, a topographer. But in this case, we will use a Keratron Piccolo topographer. We have to upload the topography data. And the Ortholen Pro design will be selected. The software will quickly select the combination of parameters that best fit the corneal topography. In this case, it selects a base carb or R1 of 7.71 and a toricity or R2 of -1 diopters, and also a total diameter of 10.20 millimeters. These suggested parameters can be modified based on the professional's criteria, such as the diameter or base curve. Although it's not common to have to do so, as the suggested values are usually the best to start with. To calculate the OR, or target myopia, simply enter the manifest sphere and vertex distance in the target power tab. The simulated fluorescent pattern, the lens main alignment zone, and the elevation value in microns over the cornea can be observed. And as you can see here, we can observe the elevation of the lens over the cornea in 360 degrees. If the topography is good, the ideal fluorogram is the one shown on this screen. The fluorogram displays an edge lift about 0.4 millimeters. The correct diameter that does not exceed the limbal zone, a properly sized alignment zone, and a good sealing on the transition zone. And of course, flat related optical zone. It is common for insertion bubbles to appear when placing the lens on the eye. Fill the lens with preservative-free artificial tears and ask the patient to place the lens while looking down with their chin against their chest to avoid the formation of bubbles during insertion. It is essential to evaluate the fluorogram with the lens centered and free from eyelids. Any misalignment, whether inferior or superior, or interaction with any of the eyelids can lead to an incorrect interpretation of the fluorogram. If the edge leaf is too thin, flatten the R1 of the lens. In the example, flattening it by just 0.10 millimeters will be enough. If the edge lift is excessive, decrease R1. In the example, decrease it by 0.10 millimeters. Choosing the correct diameter in Ortholen Pro, it is essential to ensure an accurate and fast results. The vertical corneal diameter is usually smaller than the horizontal one. Check that the lens does not touch the limbus at the vertical meridian. It is also important that the edge lift is uniform. If there are wider areas than others, or R2 must be adjusted, meaning the toricity of the lens. There cannot be misalignments over the corneal surface. Generally, the vertical one, because most astigmatisms are with the roll. Well, this is a topographical target. We need to get a perfectly sealed and centered ring so that the orthokeratology treatment is successful and remains stable over the time. Decentration may occur during the fitting process. If decentration is superior, check that the edge lift is homogeneous. If it's not, increase OR2. If the edge lift is excessive, reduce R1. If decentration is inferior, flatten the R1 if the edge lift is too thin. Lateral decentration. 3, 2, 1. Lateral decentrations, nasal or temporal, may also occur. If so, check the lens OR2, reduce the R1 value, or verify if the diameter is correct. Increase OR2 if the edge lift is not homogeneous. For lens insertion, a small suction cup can be used. The lens should always be inserted while looking downward with the chin against the chest and with preservative-free artificial tears inside the lens. The removal can be done using the classic method, manipulating the eyelids to remove the lens, or with a small tilt suction cup. Fill the lens with preservative-free artificial tears, because there is scientific evidence that higher concentration leads to greater comfort and less punctate staining. It won't be the same tear in all cases and patients. Rub with isopropyl alcohol and rinse with saline solution. Then keep the lenses in a moisturizing solution during the day, and an optional cleaning with peroxide solution with enzymatic once a week or as needed can be used. A fundamental part of orthokeratology is properly selecting the patient, which can alert us to potential complications, such as the presence of internal astigmatism, corneas that are too flat for treatment, or the existence of ectasias. The ideal patient will have myopia of up to -5 diopters and corneal astigmatism of up to 2.50 diopters. The lens may still be effective even if the candidate is not ideal. In cases of myopia no greater than -7 diopters and corneal astigmatism no greater than -4 diopters. Additionally, corneas with flake case between 40 and 48 diopters of power will be viable for orthokeratology treatment. However, corneas having a curvature of 48 diopters should be checked for the possible presence of incipient corneal ectasia before starting the treatment. Well, this is a summary of the protocol for starting nighttime orthokeratology with Ortholen Pro. First, check the patient's manifest spherocylindrical refraction, take a good topography, and calculate the initial lenses with simulens. On the day of the lens delivery, verify over refraction over the lens. Well, the goal is plus 0.50 diopters. And if it's more negative, increase OR accordingly until reaching the positive 0.50. If it's more positive, decrease OR until reaching 0.50. Check the fluorogram, its lift width, and whether it is homogeneous or not. If everything is correct, follow-up visits should be scheduled at the next morning, between the third and the fourth night in the morning, after 1 week in the afternoon, after 2 weeks in the afternoon, then after 1 month, also in the afternoon, and at 3 months of treatment and 6 months. At each visit, evaluate the evolution on status of the topography, refraction without lenses, ocular health, of course, over refraction with lenses, and also the fluorogram. Thank you very much for your attention and have a nice afternoon. Bye.